that's some place, maybe through this podcast, we can put it out to the people that it's okay to come out and say that I'm not okay and I need help. If they are positive, go to your doctor, go to your healthcare professional, and ask them that what needs to be done about this.
When we talk about diabetes, it is only restricted to blood sugar levels, but there is such a deep connection between mental health and diabetes is something we are going to explore. So what does the term, the hidden loop, actually mean in terms of medical science?
So we talked to them about the connection between the two ends, that is mind and metabolism. A lot of people still don't understand how important mental health is, and not just for somebody with diabetes or obesity, but even for normal people like you and I.
Right.
A person who is, let's say, suffering from anxiety and depression may or may not know that he's having those mental conditions.
Right.
He or she might have a dysglycemic condition or say have a deranged metabolism. On the other hand, somebody with a deranged metabolism, say his or her body produces a lot more insulin, there is dysfunctional adiposity, there is central or visceral fat deposition. All of those people, in a way, have so much of prejudice running around them in terms of, say, body shaming, somebody calling them, ab tum mote ho. And that's a very common thing. Hey, mote, meri baat to suno.
So casually said.
It's so casually said. That impacts the person's body image. That leads to anxiety, that leads to depression.
The mind and metabolism are deeply interconnected, as you said. It proves that health is not just about the food or exercise. It's also about emotions, response to stress, and mental balance.
Whenever somebody has a sort of an anxiety, what it does, it increases your stress level hormones. So those are the cortisol and the adrenaline. So when somebody will tell you, oh, aaj ye aap nahi khana, you are a diabetic. How would you feel?
Right.
So that is how that diabetes is again precipitating the anxiety and depression for that person on a long term.
It's a loop.
It's a loop, and it's a loop which is so difficult to break.
So ma'am, it almost feels like a trap. Stress affects sugar, sugar affects mood, and the cycle continues.
आप stress में हो, मैं stress में हूँ. People listening to us are under the stress. ये podcast कब खत्म होगा, मैं कितना सुनूंगा? And it is a trap. You have to very consciously seek help to get out of this.
Right.
You need very qualified professionals who can help you with this.
The reason that the older generations they still feel it's a taboo seeking help for any a condition like this could be also the society difference of joint families to nuclear families, how it has evolved. Our generation before are sorted, they know that it's a taboo. The generation next are very clear that they need help. So we are the ones who are transitioning.
The ones who are troubled. Absolutely.
So when someone is diagnosed with diabetes, doctors focus on HbA1cs, medications, diet and exercise. But mental health often gets overlooked. So should people with diabetes be routinely screened for anxiety and depression? Whether this screening itself creates more anxiety and depression, I don't know. But what should be the approach?